Greetings, innovators. We are very excited to participate in the 2020 NeuroNexus and look forward to collaborating with you. We are two strategic clinical networks, or SCNs, within Alberta Health Services that focus on specific populations of Albertans. We are comprised of the Emergency SCN and the Neurosciences, Rehabilitation and Vision, or NERV SCN. The NERV SCN has a mission to improve how Albertans see, think, and live, while the Emergency SCN aims to support quality patient and family-centered emergency care driven by education, innovation, and practice-changing research through collaboration. We have a common challenge, which is concussion management for non-sports-related injuries in the adult population. Head injuries account for 1 million visits to North American emergency departments annually. Concussion is a form of traumatic brain injury resulting in diverse symptoms, such as headache, dizziness, and loss of consciousness that typically resolve on their own within 1 to 4 weeks. Although most patients will recover after a period of observation, some deteriorate and require surgery. Government of Alberta data indicates that between 2006 and 2015, concussion-related ED visit rates in Alberta increased 102% among females and 39% among males. There is room to better the efficiency and appropriateness of these emergency department visits. Computerized tomography, or CT scans, show fractures or bleeding, but cannot diagnose concussions. However, imagine you hit your head. What do you do? Who would you call and where would you go? You might think to call an ambulance, or go to the emergency department, or perhaps book an appointment with your doctor, or decide it is simply a bump on the head and go home and rest. You may even ask for a CT scan. The challenge is that many care providers, either independently or at the request of their patients, order unnecessary scans, which are both costly to the healthcare system and create risks for patients. Although some patients receive excellent post-concussion care in Alberta, there is a lack of coordination from time of injury through to long-term follow-up for non-sports related adult concussion. Current challenges are inappropriate use of costly health system resources, delays in diagnosis and treatment, inconsistencies in provider knowledge about risk factors and specific elements of post-concussion care, long wait lists, considerable anxiety for patients and families, and a lack of clear and comprehensive information. There is an opportunity to promote self-management to empower patients. A potential solution could be the development of a smart hub of information resources, whether a mobile device app or website. Since adult concussion can result from diverse injuries and manifest in different ways, appropriately developed technology could provide tailored resources to help those affected better understand what to do. Choosing wisely and other guidelines provide tips to patients and families, but the challenge is in getting that information out in an accessible and digestible manner. Other solutions might also target this challenge, such as using machine learning for knowledge generation. We are very open to your ideas and suggestions. We will share key information guidelines with you, connect you to individuals with lived experience, clinicians, health system leaders, and local and international researchers. There may be opportunities to leverage existing work, collaborate on funding competitions to test and implement the innovation, and eventually co-author future publications. A successful innovation will feed directly into the development and implementation of a provincial clinical care pathway, positively impacting the experience and outcomes of Albertans and their providers, while reducing burden and cost to the healthcare system that we all depend on. We look forward to putting our heads together, carefully of course, no one wants a head injury, to develop an innovative solution to this important challenge. Thank you.